The prevalence of asthma in adolescents in New Jersey. Asthma is a serious health issue that affects a large number of adolescents in New Jersey. In 2008, the CDC estimated that 19,701 10 to 14-year-olds and 15,342 15 to 17-year-olds were currently living with asthma. Even though both numbers are high, asthma is more dominant in boys than girls and can be seen by the pie graph as most common in the Black ethnicity. Identification of health issues and problems are most notably breathing and respiratory difficulties. Adolescents have been affected by this disease in the following ways: more frequently absent from school, limited participation in physical activity, criticism from peers, low self-esteem, and social stability. And they are 3 times more likely to have behavioral problems. Everyday living can be problematic for these children as they are constantly unaware of when an asthma attack may occur. Furthermore, they must be prepared at all times by means of lugging around medications and inhalers everywhere they go. The major risk factors of adolescent asthma are environmental, genetics, and host. Examples of environmental triggers are dust, pollen, mold, weather changes, and air pollution. For genetics, 18 regions of more than 100 genes are associated with asthma, consistently replicated on the long arms of chromosomes 2, 5, 6, 12, and 13. Other genetic contributing factors are tobacco use during pregnancy, poor nutrition during pregnancy, maternal stress during pregnancy, and antibiotic use and infections during pregnancy. Thirdly, examples of host factors include nutritional allergies, decreased airway caliber in infancy, poor hygiene, the antibiotic allergy, and infections. Other demographic information that ameliorates the risk factors of adolescents' asthma are poor education on the disease and improper medication use. According to a survey done in New Jersey by the National Heart, Lung, and Blood Institute, approximately patients did not know how to use their peak flow meter to adjust daily medication. 68% of patients were never given an asthma action plan, and 92% of patients have never taken a course on how to manage asthma. As can be seen, the majority of factors for asthma in adolescents remain out of their control and may fall into the hands of their parents. It is strictly up to parents to help their children live with their disease and how to prepare for life once outside the family home. The 2 essential services that revolve around assessment are applied to asthma in adolescents by first monitoring health and secondly diagnosing and investigating. Health is monitored by obtaining clinical control with identifying the underlying issue and determining the best treatment possible. Reducing future risk can be accomplished by monitoring lung function and bronchial responsiveness. Adolescent asthma can be diagnosed and investigated through using a medical history, physical exam, and spirometry. Investigating a medical history will give insight on any family history, signs, symptoms, and risk factors of the illness. A physical exam helps to identify signs of symptoms and indicate areas of concern. Thirdly, the use of spirometry can aid in the diagnosis of asthma by characterizing the airflow obstruction, assess reversibility, and exclude other diagnoses. To address the issue of adolescent asthma, the National Asthma Control Program was developed. The major goal of this resource is to lessen complications by reducing the number of deaths, hospitalizations, emergency room visits, school or work days missed, and activity limitations. Additionally, the National Asthma Control Program funds programs and organizations to help improve the surveillance of asthma, train health professionals, educate those affected by asthma, and explain asthma to the public. Another resource that has been implemented to address asthma in adolescents is the Clean Air Act. This law protects the public's health and reduces asthmatics' exposure to air pollutants by reducing the EPA to regulate and maintain quality standards on the 6 criteria of pollutants: carbon monoxide, lead, nitrogen dioxide, ozone, sulfuric oxides, and PM. New Jersey has addressed asthma in adolescents by implementing their asthma awareness and education program. This resource develops control plans that track disease, implement interventions, and address occupational components. Additional agendas include a statewide clearinghouse for pediatric asthma programs and services and a statewide interdepartment asthma plan. Another way the state has addressed the issue is through Pediatric and Adult Coalition of New Jersey. This organization works towards improving the quality of life in adolescents as well as educating on how to manage asthma. They even uphold a school award program that supports New Jersey school efforts to be in compliance with New Jersey laws for asthma management and good indoor air quality. Currently, there are several policies that exist to help resolve issues for adolescents with asthma in New Jersey. First, the Asthmatic School Children's Treatment and Health Management Act of 2004 allows self-administration of medication by students with asthma. Second, the Public Employees Occupational Safety and Health Act addresses health and safety hazards in schools such as preventative maintenance, ventilation, microbial contamination, and remodeling and renovation issues. Thirdly, the Americans with Disabilities Act requires schools to eliminate and/or minimize environmental triggers for those with asthma. Finally, the Family Education Rights Privacy Act protects the student health rights. Although there are many great policies already, a couple new policies that could be developed for asthmatic adolescents in New Jersey are a mandatory asthma education course for school staff and a mandatory food allergy training program for food preparation staff. The education course would help school staff recognize signs and symptoms, resolve emergency issues, and help teach students to self-monitor. The food allergy training course would help the cafeteria staff better identify common food allergies in those with asthma, plan for prevention of contamination, and develop an emergency plan. To assist with the policy development, several stakeholders and potential facilitators have been identified. School officials would be needed to enforce the policies and ensure compliance. Medical and food and allergy specialists would be needed to educate school staff. The Health Department and the Pediatric Adult Asthma Coalition of New Jersey will both be needed to help implement and regulate education policies. The essential services of policy development are applied to asthma in adolescents by first informing of current issues, educating with facts, and empowering programs and organizations to help. Second, community partnerships are mobilized by bringing adolescents, their families, doctors, organizations, and programs together as one to reduce disparities in adolescent asthmatics. Finally, developing policy is applied to adolescents with asthma by identifying the need and offering solutions to problems. The following two slides are the references used in making of this PowerPoint slideshow. This is part 1 and will be followed by part 2 in a later screencast. Thank you for listening.